It's time for some hip tips. Did you know pelvic and hip issues can be present in very young children, but present very differently than in adults? And if those conditions aren't treated, they can not only harm development, but also cause problems later in life. That's why I talked to an Atlanta area doctor for some advice for parents.
First off, I would say that hip dysplasia can be present when children are born, or it can develop throughout adolescence. The conditions when they're younger are often silent, so pain may not be a major presenter, and it may be more of a limp or a leg length difference or stiffness or things that we can detect on exam. But a lot of the young patient hip problems are sort of silent until there's starting to be some tissue breakdown and things that can cause pain. So for newborns and babies, the pediatricians will perform routine hip exams every time they bring the child in for a well visit until they are walking. Children should normally be walking by the time they're age 18 months. So if your child is not walking at 18 months, that would be a reason to get things checked out. If parents feel that one leg looks longer than the other, if they have an asymmetry in their motion, so if their legs don't go off to the side, abduct their knees apart as much as they should, or other children they've had, or if one knee goes out to the side farther than the other when they're changing diapers, that would be a reason to be evaluated further. If they feel a shifting in the hip bone, not necessarily a click, like a knuckle kind of a click, but if there's a shift in the hip bone, more of a clunk, that should be a reason to be evaluated further. One other thing that's sort of important to realize is that hip pathology in young people in particular doesn't always present as hip pain. Frequently, the kids will have thigh pain or even knee pain that can be referred from the hip. So it's important for us, healthcare professionals, to evaluate the hip whenever a young person comes in with complaints of knee or thigh pain or issues.
What are some of the treatment options?
Big topic, right? Depends on the pathology. In the babies with hip dysplasia, it's frequently bracing. So it's a device, either a Pavlik harness or a rhino brace, something to position the hips in a better position to allow that normal development to happen. Some of the kids, if they're walking age and have hips that are out of position or dysplastic, that tends to be a little bit more surgical, and we typically protect those kids in a body cast called a spica cast.
And how common are hip and pelvic issues in children?
Um, Fairly common. Hip dysplasia is about 1 in 1,000 US births.
Saving Georgians one scan at a time. Get a free heart scan for you and your partner with minimal requirements. Visit virtualimagingatl.com.